Sometimes in life, things happen to us and we need to get some help. And there's certainly a lot of people that can do that, but you know what? There's also people that can help you out before things happen as well. That's the type of people we love to have here in the studio, and today is one of those days. Our guest today here on All In with Brian Weatherford, her name is Shelly Kaplar. She's a PhD in her company, Vitality Optimizer. Shelly, welcome to the show today. How are you?
Thank you. I'm doing well, thank you.
Well, it's great to see you. You do business down in the Austin, Texas area.
I do,
right?
yes.
Right here, the great capital here in the state of Texas. So, what is it that you give me a couple of bullet points? I mean, you do so many things. I don't know where to start. I'm going to let you start. Give me some bullet points of what you do there with your company.
So I am the Vitality Optimizer, and I optimize really people's vitality and literally work from the inside out right down to the cellular level. I created the Kaplar Method 19 years ago, and it gets people off of that systemic chronic loop for chronic pain, autoimmune disorders, and I also specialize with brain injuries.
Goodness gracious. Now you have a little, sadly enough, but actually it worked out for a lot of people. You have some personal experience with this.
I do.
Right? Do you mind going into that a little bit?
No, not at all. I was able to put my Kaplar Method to the true test when I was hit by a drunk driver just over 4 years ago. The doctor said I should have been dead. Clearly I'm not, thank goodness.
Thank goodness, yes.
And my neurologist said, he's like, given what you do, you can go heal yourself. Now, I had 4 bulging discs in my cervical spine, 2 in my low back, 3 millimeters up to 5 millimeters. And mostly doctors will start doing surgery at 3 millimeter bulge and above. So no disc surgery, no stint or anything in my brain, and as of October 26th my brain has been completely healed and I no longer have any bulging discs in my back.
Well, you know what? That deserves one of these.
Well,
that's outstanding.
It's pretty awesome.
I mean, it's pretty awesome. I mean, first of all, thank goodness the Kaplar Method was around.
Right, yes.
You know? I mean,
yes,
it was
I'm
almost
thankful.
like a predestined thing. So before you needed to work with yourself, give us some people, not obviously not names, but the types of people who would come to you to see if you could help them out.
Typically, I would see patients who had exhausted all of their resources within the medical field and within the alternative field. So I was their last resort. It was more with people with chronic fatigue, chronic pain, autoimmune disorders that weren't getting any answers from the Western medical field. Mm-hmm. Their treatment protocol with their medication worked, and then they would, quote unquote, go into remission, and then all of a sudden they would get sick again and the treatment protocol wouldn't work. So then they couldn't find a medication that would work for their autoimmune disorder. And sports injuries, people who had surgery, I would decrease their healing time in half. So like with Dak Prescott with his ankle injury, mm-hmm. they say 3 to 6 months. I would be like, you know, that's 2 to 3 months for me.
You know, he just works up the street here from the studio.
I know, I drove past. I was going to pop in, but I didn't have enough time.
Well, we'll give you directions after the show,
great,
but
thanks.
I still have more questions for you. You know, you're talking about the autoimmune, I can't pronounce the word.
Disorders.
Yes. Or is it true that some of that is dietary?
It will be affected by dietary. Mm-hmm. So your dietary choices can cause a flare-up, but the autoimmune disorder as itself is not caused by your dietary choices. My first question that I always ask is if they've had mono or have known someone that has had mono within their life, and 9.9 times out of 10 the answer is yes, and that's where that
that's where it starts.
That's where it starts.
So I could have known someone with mono 30 years ago, and unbeknownst to me, somehow that was implanted in me and then reared its ugly head all these years later.
So there's approximately 330 million people in the U.S. 300 million people are carriers for the Epstein-Barr virus, which mono is one of the viruses out of 5 within the Epstein-Barr family. And it stays dormant within your system. So there's usually a chain of events that happens, and it can be anywhere from an accident or a life event that will then kick everything into gear and flip that switch if you like to get everything started for an autoimmune disorder.
But working with you with the Kaplar Method, we can flip the switch back the other way?
Yes.
Goodness gracious.
I had a Lyme disease, a client suffering from Lyme disease. He was sick for, a couple of decades and no longer has Lyme disease.
Okay, you in your notes, you told a great story that I'm not going to do it justice. I'm going to use you to tell the story, but I'll tell you which story.
Okay, good,
The
thanks.
story about, yeah, because she has a lot of great stories, by the way. This was the one we were talking about modern Western medicine and everything, to where somebody, they had a fractured wrist. And they went to the doctor, and the doctor said, go ahead, give us the story.
So a patient of mine, she had fractured her wrist while cycling, and we started treatments with the Kaplar Method. She had gone back for her 3rd week appointment, and her doctor was like he's like, I'm a little disappointed. You should be further along by now. She's like, I don't understand what you mean. And he's like, well, I'm looking at your x-rays, and for 6 weeks along, you should have more mobility and you should have more strength. And she's like, but this is my 3rd week appointment. And he's like, wait, what?
Yeah, what's the takeaway there?
Right. So that just shows that how the body truly has the capabilities to heal itself. You just have to give it the right tools. And I am grateful to be one of those tools within somebody's little toolbox.
So what were you doing? I mean, before there was a Kaplar Method, I mean, when did you, were you doing some other stuff and tweaked it, or give me a little backstory on that?
So initially I went back to college for massage, nutrition, kinesiology, and had looked at pre-med, looked at the length of time that I would have to be in school, and I'm like, no, thank you. And then thought eventually there'd be nursing. I don't like blood or needles, so then that eliminated that quite quickly. So it was in massage and all of my other continuing education that my instructors were saying that I was doing more than what they were teaching me. So it was through continuing education after I graduated from college that I discovered, what exactly I was doing, and then worked with some mentors where we came up with, well, this is your Kaplar Method because you've discovered it, and this is what you do.
Have we reached the point yet to where other people are adapting the Kaplar Method themselves?
That I'm not too sure.
Okay.
I haven't really done any research into it.
So frankly, if I want the Kaplar Method, I need to go to Kaplar.
Yes, you do. Yes.
To come to you. And again, that's in Austin.
Yes.
Okay. Do you do a lot of work via the internet? If I'm not in Austin, but I want to work with you, does that were you doing this pre-COVID? That's where I was going next on that.
I was. I've worked with people out of state, Virginia, North Carolina, and Washington area is where I've worked with people out of state. I've worked with people down in more south, Texas, but if it's close enough, I'll drive because it's not that far, and
Well, I
there's
think
not that much
for
construction.
people that are going through everything that you can help. I mean, hopefully nobody's going through everything you can help
Right.
with, but with everything that you can help with, that's a better way to put it. I think that the drive would be worth it either direction.
True. Yes.
For them. Yeah, I guess, are you on a referral type basis? Have you had a situation to where maybe somebody was suffering from Lyme disease and all of a sudden they're better and people notice, say, oh my gosh, what'd you do? I say, I don't have Lyme disease, but I've got this. And they say,
Right.
well, you might want to call Dr. Kaplar.
I am.
Does that happen?
Yes, I do get a referral base of clientele.
Well, that's huge. That's just huge as well. Where do you see us going with this? I mean, you mentioned you've been doing the online thing. Obviously, I'm sure that's cranked up here in recent months.
It's been a bit slower, and I think it's more because everybody is so COVID focused with what's going
Sure.
on right now, and so I've taken a bit of a back seat. But yes, online is definitely.
Well, everybody's COVID focused right now, but make no mistake, everything that you work with is still out there.
True.
COVID didn't knock everything else
No,
out of the picture.
it definitely
It's
did
taken
not.
the forefront. Everything else is still there. Most importantly, you're still there as well to help people through everything. And I think the fact that you're able to use your own method on yourself tells a great story in itself. Appreciate you. Speaking of stories, you have a great one. We appreciate you letting us share it today here on All In.
Thank you.
Thank you very much. Safe travels back to Austin.
Thank
and
you.
we'll get you over to DAC here in a minute.
Awesome.
Take
Thanks.
care. Folks, thank you as well. We'll catch you next time on All In.